we are going to be talking about common drugs used to treat arthritis and other autoimmune conditions and how they affect the body. But before we get started, for those of you who aren't familiar with who we are, my name is Jessica Melnick. I'm a registered holistic nutritionist, the founder of the Anti-Arthritis Method, the host of the Happy Joints Arthritis Solutions Group, and I help both women and men with various forms of arthritis get back to living life the way they choose to, not the way that they have to. And I'll pass it on to Casey.
Yep, I am Casey Kephart. I am a functional medicine nutritionist. I'm the founder of the Feel Good Formula, and I work with women with all different types of autoimmune diseases to get you back to the activities you love, trash your symptoms, get your life back, basically. And I live in St. Petersburg, Florida.
Amazing. So like I said, today we're going to be talking about some of the most common drugs that are prescribed for arthritis and other autoimmune conditions, because I think it's really, really important to know what we're taking and the possible side effects, how that's affecting our body, and what we can do about it, if anything. Because I know sometimes there is a time and a place for medication in order to get things under control, but I know a lot of our clients, their goal is to really wean off of or go off of their medications, or at least some of them, because they are experiencing side effects or just negative symptoms because of the medication. So we want you guys to have all the information and all the options. So we're going to start off by talking about methotrexate. So methotrexate is very, very commonly prescribed for arthritis and autoimmune conditions. So autoimmune forms of arthritis like rheumatoid arthritis in particular. And it's actually an immunosuppressive drug that is commonly used for cancer. So very serious medications. Now, when we look at the actual, what is actually contained in the drug itself that could possibly be creating a sensitivity or allergy for you, we've got lactose, which is the protein in milk. So if you're lactose intolerant, that can be a problem. It also contains starch and cornstarch often. So a lot of my clients and myself are very sensitive to corn. And depending on how sensitive you are, that can actually trigger a flare-up. So just to be aware of that. Now, another thing that methotrexate does is that it sucks up your folic acid. And so that is why if you are on methotrexate, your doctor is going to also tell you to take a folic acid supplement. Mm-hmm. So very, very important. Another thing you need to be aware of when it comes to methotrexate is that you need to increase your fluid intake, and because you're also going to be having more of a urine output. So your kidneys are going to be working a little harder, and you are more likely to be dehydrated. So it's very, very important to make sure that you are drinking lots of extra filtered water. Mm-hmm. And another thing we really need to be aware of is that it's also going to decrease the bioavailability of the food we eat. So that means that we are not going to be absorbing the nutrients from the food that we eat as efficiently as if we weren't taking the drug. So I would say really important to make sure you're taking a multivitamin and multimineral supplement, but something that is a highly bioavailable and methylated form that is a very good quality. So talking to a health practitioner like myself or Casey, or a naturopath or a functional medicine practitioner. So you're making sure that you're getting something that your body can absolutely absorb, because there's a huge discrepancy in quality of supplements out there.
Yeah.
Another thing that's also super important is that we need to make sure we're avoiding alcohol while we're on methotrexate, because it can cause hepatotoxicity, which essentially means it can make our liver toxic. It's going to affect our liver functioning. And like I said before, it's going to decrease your renal function, so your kidney function, in addition to your hepatic function. So that's why if you are taking methotrexate, your doctor is going to be doing regular blood tests on you to make sure that your organs are still functioning properly. So something that you should be aware of. Other risks with taking this drug are ulcers, headaches, fatigue, pancreatitis, and unexplained weight loss, colitis, which is an inflammatory bowel disease, bone marrow suppression, which also suppresses the immune system, And another thing to be aware of is that consuming caffeine while you're on this drug can also reduce the effectiveness of the drug. So lots to think of there. Now I'm going to pass it on to Casey to talk about hydroxychloroquine, which is also another very commonly prescribed drug for arthritis
Yep.
and autoimmune.
Um, so this drug is anti-malarial, anti-arthritic. It helps with lupus. Um, what is in the tablet as for ingredients? It just says starch. So this one is supposedly does not have lactose in it if you are trying to stay away from dairy, which is good to know. This drug can cause unexplained weight loss. I mean, it's not really unexplained if you're taking the drug and know it causes weight loss, but
Mhm.
um, other side effects is abdominal cramps, diarrhea, headache, itching, dizziness, visual changes, fatigue, muscle weakness, emotional and psychological changes, which would just equal like mood swings if you're finding yourself a little more moody, photosensitivity, hair loss, irregular heartbeat. Um, so a lot of these symptoms already we have with having an autoimmune disease. So we might think that it's just our autoimmune disease causing these symptoms. So we just want to plant the seed in your head that yes, your autoimmune disease may be doing that, but also check the medication side effects that you're taking that can exacerbate these symptoms or cause more symptoms that you didn't have before. Um, with this drug, you also want to monitor your muscle strength because it can cause a decrease in muscle tone or muscle bone density. And one of the things it said to do was limit your grapefruit consumption, whether that be juice or the real fruit, just because a lot of grapefruit, there's something in the grapefruit that makes drugs less active. So this isn't the only drug that grapefruit seems to have an interaction with. And this all goes to show too that a lot of a lot of changes in your diet and lifestyle don't have these side effects. So if you're looking to feel better, um, keep talking to Jessica and I so we can help you with that. But
Absolutely.
Jessica, do you want to take prednisone, which is also a
Yeah.
very big
Prednisone is also near and dear to my heart in all the good and bad ways. I'm very familiar with prednisone because I have taken it myself when I've had a really bad arthritic flare up. And it is, of course, your doctor is going to tell you you do not want to be on this drug long term if you can manage without it, because there are a lot of long term side effects. And there are short term side effects as well. So, one that I really noticed with myself was it suppresses the immune system. So, it makes you way more susceptible to getting sick. So, if you have grandkids that you're around, or nieces and nephews that go to school and pick up everything at school, you are way more likely to get sick because your immune system is going to be suppressed. So, let's talk about a few other things just to be aware of with prednisone. Um, you're going to want to take this with food because it can really affect your stomach and your GI tract and limit caffeine as well. So, you're also going to want to decrease your sodium because it's going to also give you some water weight gain, and you're going and water retention. So, we also otherwise known as edema, so swelling. If you've seen these swelling in your ankles, maybe talk to your doctor about that. Just be aware. You're going to want to increase your calcium intake and your vitamin D and your protein intake, because long-term use of prednisone also causes muscle and bone wasting. So if you're taking this long-term, you're really dealing with a lot of other risks that may almost be just as bad as having arthritis or another autoimmune condition. Again, caution using having grapefruit and other citrus fruits with this medication. It will increase your appetite. It can increase weight. And another thing that is dangerous is that it actually increases glucose in your blood. So if you have diabetes or if you've been pre-diabetic before, you have to be very, very careful with this. So It also decreases your kidney function and it causes calcium wasting. So, like I said before, it can cause muscle wasting and also bone density. What's the word? Decreasing your bone density because it is also wasting calcium in your body. So that is why a lot of people who take this long term can end up with like osteopenia or osteoporosis. So that's another really big risk. You're also going to want to avoid alcohol and simple carbs because, again, it increases your blood glucose levels, which increases your risk of diabetes and all the other things that come along with having high insulin for a long term period of time. And of course, alcohol is damaging to the liver, and prednisone itself is damaging to the liver. So you have to be very, very careful with that. It increases your blood pressure. It can give you insomnia. It slows the healing of your body. You can bruise easier. You can have headaches. You can have psychological and mood disturbances. You can have skin issues like acne or rashes. You can even have seizures. So these are all symptoms that can be really common with long-term use of prednisone. And of course, because I was mentioning before the decrease in bone density, you need to have your bone density checked every 6 months to make sure that they are not becoming brittle. And you're also going to need to take electrolytes. You also need potassium to balance the sodium. So, again, you have to be careful with how much sodium you're having, but you're also going to need potassium because this is also, like we had mentioned before, it's going to create a lot of water retention in your body. And just in the tablets themselves, they contain lactose. So if you're lactose intolerant, something to be aware of. And they contain sucrose, which is basically a sugar alcohol, which can be really irritating to us as well.
Mhm.
So it works like a magical pill when you have a flare up until it stops working, because it also becomes less effective over time, unfortunately. So if you can work with us to figure out how to manage your symptoms and get them under control without taking prednisone for the long term, you are so much better off and you can avoid all of those types of risks and symptoms.
Mhm. Yeah, what a heavy drug that is. A lot to look out for. And while you're on it and while you're feeling good is probably the best time to start your new lifestyle and diet changes while you're feeling this way. So think about that next time too. The next one would be aspirin or Tylenol. This is in the category of NSAIDs or non-steroidal um,
Anti-inflammatory.
anti-inflammatory drug. So aspirin, you want to take after meals to reduce the risk of some tummy aches, GI distress. It decreases the rate of food absorption. So just meaning that you're not absorbing as many minerals or vitamins that you could be without taking this. You'll want to increase foods high in vitamin C and folic acid. You'll want to limit your caffeine to decrease, again, like tummy aches and GI distress. Um, Something interesting about aspirin and Tylenol was you want to avoid garlic, ginger, ginkgo, ginseng, and horse chestnut because it interferes with blood coagulation. You want to avoid alcohol as well, which is funny because sometimes we take this with alcohol or near alcohol to help with the effects of it. But that can become very dangerous, especially if you take too much or had too much alcohol. It may cause gastric bleeding and black tarry stools. Not recommended for children, at least. I know there are baby aspirins and baby Tylenol, so that would be what you would want to look for the children. And may cause tinnitus, which is ringing in the ears, or hepatotoxicity, which is just a toxic liver. Um, a lot of pharmaceuticals, a lot of over-the-counter meds just do cause hepatotoxicity, so you will be seeing that or hearing that from us a lot. It does breaking down drugs, pharmaceuticals, man-made chemicals is a lot for the liver. and it is very toxic for the liver. So anything that is long term that you're doing, even a baby aspirin for your heart every day, does affect those liver enzymes and the filtration process and all of the things. One point about the tinnitus, tinnitus, ringing in the ears, is very hard to figure out why this is happening, what is causing it, and how to get rid of it. There's very controversial research out there, and there's very limited remedies for tinnitus. So I'm saying this because if you take aspirin or Tylenol a lot and you do have tinnitus and haven't figured out why, this may be a missing puzzle piece that you've been looking for too. And the next NSAID we're going to go over as well causes tinnitus. So hopefully that helps anybody with that issue because it's annoying.
Very.
Mm-hmm.
So Advil, so ibuprofen is the drug name of Advil, Motrin, Aleve, and meloxicam, which is just a higher strength prescription grade ibuprofen that is often prescribed for pain in general for a lot of my clients with arthritis. And like Tylenol or aspirin, we want to make sure that we're taking this with food so we can avoid stomach ache, ulcers, GI distress. You're going to want to limit or avoid caffeine and products that affect the blood coagulation as well, just like aspirin. So things like garlic, ginkgo, ginseng, ginger, and horse chestnut. So some of those are herbs that you may not be familiar with, or you may be familiar with. If that sounds familiar, if you are taking ibuprofen, don't take them together, because essentially it is thinning your blood. And so that's why you're not supposed to drink alcohol with it either, even though, like Casey said, often we take Advil or we take aspirin if we have had too much to drink and have a hangover. So not the best. I know it helps you feel better, but you don't want to make a habit of it. Advil can also decrease appetite. So if you are dealing with decreased appetite or unexplained weight loss from some of your other medications or from your arthritis or another autoimmune condition, be aware of that as well. That could be part of the problem. It can cause abdominal pain, bloating, constipation, diarrhea, colitis, gastrointestinal ulcers, and bleeding and flatulence. So no fun there, really hard on the gut system. It can also cause edema, so swelling, water retention. It also decreases our hepatic and renal function, so our liver and our kidney function. Don't want to use this during pregnancy, especially in the third trimester. And like Casey said, just like aspirin, ibuprofen is also a cause of tinnitus. It can also cause depression, headaches, even though it's supposed to get rid of them, nervousness, or a hyper or hypotension. So it can affect your blood pressure either up or down. And the tablets themselves may contain sulfites, which for some people who are sensitive, sulfites are often found in wine. That's really common as well. It can have artificial sugars in the tablets and also cornstarch. So just three of the things that a lot of our clients and ourselves are very sensitive to are contained in many of those Advil and ibuprofen tablets.
Mm-hmm.
So I'm really curious about the laxatives thing. We're going to talk about that next. So can you tell us first, before you go into some of the risks, why would people with autoimmune conditions be really familiar with laxatives?
So a lot of people with autoimmune disease have constipation. So the media and doctors tell us that laxatives help just get that stool going because we need to detox through our poop, and we can't be constipated for a long-term time. So laxatives kind of help get that bowel mobility going and just pushes it out of you basically. So a lot of people who do have autoimmune disease are susceptible to constipation, and that's where the laxatives will come in because we don't really know of a better source or way to get that motility going in the bowels. So some things that laxatives can cause, or Miralax would be a big laxative that's just over the counter. There's commercials about it. Doctors tell you to go get it. can cause nausea and bloating, cramps, flatulence, diarrhea. You go from being constipated and now you have diarrhea. Electrolyte problems like low potassium, because if you just keep pooping now because of the laxatives, you're going to miss a lot, you're going to lose a lot of electrolytes in you. So we need to replenish that. Um, and then it can make the bowels lazy as well. So if your bowels are reliant on this laxative to get things going and moving and the peristalsis and everything, your bowels, your body really doesn't need to work anymore. So when you stop taking these, because laxatives can be very addicting too, I think. When you stop taking these, your bowels that what's the word I'm looking for? I think it's peristalsis,
It's
but
peristalsis. Yeah.
okay.
Yeah. It's the muscle contractions of our bowels.
Yeah, it kind of just stops working. It gets lazy and it's looking for that additional help. So very, very dangerous in that case. I know a lot of people use laxatives also to lose weight. So if you are doing it for that sense as well, there's these same side effects too. Um, so Miralax contains polyethylene glycol, which is very similar to antifreeze. It's the food version of antifreeze, which is still not good. It's a chemical. It's man-made. It's toxic. And why are we taking anything that's not coming from nature in general or animals? So um, one of the things that laxatives slash Miralax can interfere with is prednisone. So, as you know, prednisone is very common with people with autoimmune diseases. So, if you have an autoimmune disease and taking Miralax for your constipation, just know that it's going to be interacting with your prednisone, meaning you might have to take more prednisone because it's not working effectively, or you're going to have more pain just because that prednisone can't kick in. Um, so, what would be a better option than taking laxatives in general would be some magnesium citrate or ascorbate. Buffered vitamin C also does this. There's like a timing of the buffered vitamin C that you need to do, and work your way up until it hits the bowels, and then you can stop there. If you take too much, you're going to be literally running to the bathroom and hoping you make it. So there's a timeline and a right way to do this to get that kind of laxative effect. But magnesium citrate is the very common one to get those bowels moving. If you're taking magnesium glycinate, you're going to be upping your magnesium levels more than touching the bowels with that. So just depends what type of magnesium you need for the issues that you're having. And I don't think this needs to be said, but I'm going to say it anyways. If you are having troubles with constipation and you are trying not to use laxatives, please talk to us. We can help. There is obviously something going on in your body, your autoimmune disease, your diet, your lifestyle, all the things that we can help point out to you.
Yeah, there are much, much healthier ways to go about solving constipation. And a lot of it has to do with eating right for your body and your autoimmune condition.
Yeah.
So, in addition to laxatives, one of my other huge pet peeve medications is antacids,
Mm-hmm.
like Tums. Um, so, in general, this tablet can contain sucrose and cornstarch. Again, things that a lot of people with autoimmune conditions are sensitive to. And you have to take it separate from high fiber, oxalate foods like spinach, foods that contain phytates like grains, seeds, legumes, and some nuts. So, pretty much half the food that most people eat. So, not exactly convenient,
In our protocol.
right?
Well, maybe not. We don't have grains, seeds, legumes. No, never mind. Not on our protocol.
No, we don't have that stuff in our protocol. No. So it also decreases your body's absorption of iron, zinc, and magnesium. So for those of you who don't know this, most of us who are suffering from arthritis or an autoimmune condition typically have low iron, sometimes to the point of anemia, which is sometimes part of the reason why you feel so dang tired all the time, and a zinc deficiency as well, which means that your immune system is not functioning properly, which we obviously know that in the case of autoimmunity, but it's really going to make you more susceptible to being sick more often. And it also decreases diarrhea, which is not a bad thing necessarily, but we don't want you taking laxatives and then taking Tums and then just keep going back and forth between constipation and diarrhea all the time.
Ugh.
So yeah, and like laxatives, it's going to make your GI symptoms worse over time. So it's going to cause things like abdominal pain, bloating, flatulence, and constipation. So yay, now you don't have heartburn, but now you're constipated. And that's
So there
because,
comes the laxative.
yeah, so you're just making this vicious circle of going back and forth and around, fighting off the constipation and then fighting off the diarrhea. So the reason this happens is because the antacids are shutting down your digestion. It literally turns off your stomach acid. And we need stomach acid to digest our food. It's super, super important. So if we're not digesting our food in our stomach and we don't have enough stomach acid, then we're not absorbing the nutrients from our food. And then we're likely going to get constipated later down the line because we need stomach acid to have peristalsis, which is the muscle contractions of our bowels to move the food that we've just eaten along our digestive tract so it can be used, and then the waste products of that can be eliminated. So we're literally shutting that all the way down. So not good, especially for long-term use. So it can also cause kidney stones in high doses, and it also causes calcium loss. So if you are at risk for osteopenia, or if you have osteopenia or osteoporosis, you don't want to be having Tums. It also interacts with aspirin and prednisone, which are commonly used if you're dealing with arthritis. And again, it causes malabsorption. So it shuts our digestion down. We're not absorbing the nutrients from our foods. If we're not absorbing the nutrients from our foods, we are not going to have energy and we're not going to heal or get better from any kind of illness that we have, especially our autoimmune condition. So when we shut down digestion in our stomach, I'm going to go back to this. When we have no HCl, we've neutralized it with the antacid, all of this undigested food gets shoved along into our small intestine before it's meant to be there. Then our pancreas has to work extra, extra hard producing all these different enzymes so that it can digest that food that's not properly digested and getting stuck in our small intestine. So again, we don't want that to happen because we're not going to be properly absorbing our nutrients from our food. And not only that, if we don't have properly digested food in our small intestine and we're not absorbing things properly, that's when the bad bacteria in our gut likes to feed on it. And then we're just making our bad bacteria in our gut, our population, that much higher. And then we call that dysbiosis. And so that means when the bad bacteria is in greater numbers than the good bacteria. And that causes a whole host of other digestive tract issues. And oh my goodness, everything from bloating, constipation, oh my gosh, like the list goes on and on and on. And it can even get so bad as it causes SIBO, which is small intestinal bacteria overgrowth, which is hard to get rid of. You're going to feel extremely distended and bloated after every time you eat. It is not good, like I said, and it takes a very skilled practitioner to help you get rid of that. So if you can avoid antacids at all costs, there's ways that you can eat properly and there's ways you can adjust your lifestyle so that you're not dealing with things like heartburn, so you don't need these things in the first place. So I'm just trying to think if there's anything else that I need to warn you
Can I
about.
add something?
Absolutely, please do.
Yeah. So when we eat foods that cause that acid buildup or gastritis or whatever it is that where you think you need to take an antacid, like lots of alcohol can do that. We think that we are over acidic because you're burping up this acid, right? And that's why we pop the antacid. It's actually we don't have enough acid, and that bubble up is coming up into your esophagus that esophageal sphincter is not working properly now, and that's why you're having these symptoms. So then we pop the Tums to help this, and the Tums is there to alter that pH. However, it's altering the pH and making it more basic. So we're just masking the symptoms. It's a short-term relief. They do work. But then that cycle comes back again because that body is still not as acidic as we need it. So it should, your pH and your stomach acid should be from like 1 to 3 on that pH scale. And those Tums don't make it 1 to 3. So some things that we can do to help stop that that buildup of acid coming up in your mouth is taking apple cider vinegar, which is very acidic. If I think we all know what apple cider vinegar is, and some of us take shots of it. Some of us have a very worn like throat already from all of that acid coming up, where we will need to water it down, put it in a drink. And that does the same thing. So there's certain foods and certain like apple cider vinegar and probiotics that you can do that will help put your pH back into balance. So moral of what I was trying to say is that it's not because you're too acidic, it's because you're too basic on the scale.
Yeah, and I think that it's confusing for a lot of people because they're like, well, if I have this acid coming up, how do I not have enough acid? And what's happening is that your stomach, you either ate too much or something that does not agree with you, and your stomach is like churning and it's like spasming and it's trying really, really hard to digest this food and do what it does. And that's what's causing that backsplash of that stomach acid. It's your poor stomach is just working so hard. So that's why we have a lot of digestive enzymes we use in our program. HCl is another great thing that you can use. You just have to make sure that it's not going to interact with any other medications you're taking, because it can interact with certain medications. So I hope this was informative for you guys. And we don't tell you this to scare you. We tell you this because you're not going to hear this from your doctor a lot of the time. And we just want you to be fully aware of the risks that are involved and the alternatives as well.
Mm-hmm.
So if any of this struck a chord with you, comment below, reach out to us. We'll be more than happy to answer your questions. And anything else you wanted to add, Casey?
No, that's it. I hope everybody has a good day.
Awesome. Take care, you guys. We'll see you next week.
Bye.